My name is MJ Marks, and I'm the Director of Quality for Glendive Medical Center.
And I'm Timber Dunby-Wolf. I'm the Director of the Dawson County Health Department. Today we'd like to talk to you a little bit about some questions we've been receiving on COVID-19. So positive cases of COVID-19 are mostly in western Montana. However, we do have some cases a little bit closer to Dawson County. We have one case in Hill County currently and one in Roosevelt County. The majority of the cases are located in Bozeman and Billings. Currently, there are not any cases in Dawson County. So influenza exhibits similar symptoms to the COVID-19. We're currently at our peak season. Typically in eastern Montana, our influenza season ends in May.
We have seen influenza cases at Glendive Medical Center. Very few of them have needed to be hospitalized. They've been able to go home and get better at home. Like Timber said, this is peak season in eastern Montana, and we kind of have a tendency to run towards the end of what the CDC says is the typical season of October 1st through March 31st. It has not been uncommon in eastern Montana to actually have an influenza outbreak in April. So we're really ramping up influenza right now, and makes things confusing for not only those people at home, but also for our providers.
So not everybody that has COVID has severe symptoms. Symptoms range from mild, and even they're finding now that there are people who are asymptomatic. And that's where we're seeing more spread. So with that in mind, that is why it's so important for us to practice social distancing, stay home when you can. If you're sick, stay home.
I think other things that we could say is mild symptoms are you might just feel like you have a cold, the common cold, and so we really encourage people to just stay home when you're not feeling well. You don't realize how quickly you're spreading this particular virus. The other thing is moderate symptoms are, you're probably having a fever. A fever is indicated by being 100.4 degrees or higher by the CDC guidelines. And that is when you need to be thinking about, are you coughing? Are you feeling short of breath? That is when you need to be looking to seek some health care. We do want you to stay home for as long as you feel comfortable. But we do have our hotline here at Glendive Medical Center that you can call. That number is 345-8811. That is manned by a nurse who can take your call and answer your questions and also assist you to make an appointment in an appropriate healthcare setting. Someone who is feeling extremely short of breath is someone who would need to come into the emergency room. We always want people to call ahead and let the ER staff know what you are experiencing because that helps them prepare for your arrival and makes sure that transition into the emergency room is done smoothly. If you need to dial 911, please let the dispatcher know as well what symptoms you are having. That also helps our emergency medical services be very prepared to take the best care of you possible. We are continuing to take patients in the clinic. Most of our providers, because they want their patients to be safe, have felt that if it's a non-essential visit, for example, a non-essential visit would be someone who's diabetic, their blood sugars have been very under control, and their doctor feels comfortable that they can just continue and they will refill their medicines without that appointment. Other things, we are having Our orthopedists are seeing patients as well, and that is still available to you. Obviously, if someone needs medical care that is related to another health concern, we are always open for that as well.
The thing that everybody in the community needs to do is to continue with the social distancing, remain at home as long as you can, limit your outings into the community.
At Glendive Medical Center, if we have a positive case, it will be business as usual. Those of you who have come to the clinic or to the hospital know that there are some things already happening where we're only coming into entrances. People are asking you some questions. You're getting your temperature taken. In those situations, that's not going to change. Internally, it's not going to change. We're still here to take care of patients, and that's what we're going to continue to do. Once we have a positive case here in Dawson County, we know that people will have questions. We ask them to call our Respiratory Triage hotline at 345-8811. This will give them an opportunity to speak to a nurse who will be able to assist them with their symptoms and talk them through what's happening. At this time, again, social distancing and staying home is really the best thing we can do. Obviously, if you're running a fever, you're feeling a little bit short of breath, you're just feeling really yucky, please call ahead to that hotline so we can get you into the appropriate place to be treated. At Glendive Medical Center, our emergency room is continuing to be open 24/7. So please don't feel that you have to stay home if you are having a medical emergency. That's what our emergency room is here for.
At this time, we'd like to let you know that we've been working closely together. We're prepared for COVID to come into our community. We encourage you to remain calm, and we will give you some sites at the end of this video that you can find good information, reliable information. For the most up-to-date information on the number of cases and where they're at, you can visit covid19.mt.gov.